Okay, today let's discuss mechanism of labor. It refers to the series of changes in position and attitude that the fetus undergoes during its passage through the birth canal. It is described here for the vertex presentation and the gynecoid pelvis. Okay, so here is a mnemonic to remember the mechanism of labor, which is ED fire. E indicates engagement. The fetal head normally enters the pelvis in the transverse position of the widest pelvic diameter. Engagement is said to have occurred when the widest part of the presenting part has passed successfully through the inlet. The number of fifths of the fetal head palpable abdominally is used to describe whether engagement has taken place or not. If more than two-fifths of the fetal head is palpable abdominally, then the head is not yet engaged. Descent. D stands for descent. Descent of the fetal head is needed before flexion, internal rotation, and extension can occur. During the first stage and passive phase of the second stage of the labor, descent of the fetus occurs as a result of uterine contractions. In the active phase of the second stage of labor, descent of fetus is assisted by voluntary efforts of the mother using her abdominal muscles and the Valsalva maneuver, pushing. F indicates flexion. The fetal head is not always completely flexed when it enters pelvis. As the head descends into the narrow mid-pelvis, flexion occurs. This passive movement occurs in part due to the surrounding structures and is important in reducing the presenting diameter of the fetal head. So that's why it gets flexed. I indicates internal rotation. If the head is well flexed, the occiput will be the leading point, and on reaching the sloping gutter of the levator ani muscles, it will be encouraged to rotate anteriorly so that the sagittal suture now lies in the AP diameter of the pelvic outlet, which is also known as the widest diameter. If the fetus has engaged in the occipito-posterior position (OP position), internal rotation that can occur from an OP position to an OA position. OA stands for occipito-anterior. This long internal rotation may explain the increased duration of the labor associated with OP position. Alternatively, an OP position may persist, resulting in phase to pubes. Phase to pubes delivery, which occurs in OP diameter. Furthermore, the persistent OP position may be associated with extension of the fetal head and a resulting increase in the diameter presented to the pelvic outlet. This may lead to the obstructed labor. Leads to the obstructed labor. It is an MCQ point, and the need for an instrumental delivery or even cesarean section. Now comes E. Okay, so the ED fire was like FIERE. So here comes E, which stands for extension. Following completion of the internal rotation, the occiput is beneath the symphysis pubis and the bregma is near the lower border of the sacrum. The well flexed head now extends and the occiput escapes from underneath the symphysis pubis. This is known as crowning of the head. So here crowning of head occurs during extension part. This extension process, if controlled, reduces the risk of perineal trauma. However, the soft tissues of the perineum offer resistance and some degree of tearing occurs in the majority of first births. R stands for restitution. When the head is delivering, the occiput is directly anterior. As soon as it crosses the perineum, the head aligns itself with the shoulders, which have entered the pelvis in the oblique position. The slightly rotation of the occiput through 1/8 of a circle is called as restitution. External rotation. In order to be delivered, the shoulders have to rotate into the AP plane. Remember the widest diameter at the outlet. When this occurs, the occiput rotates through a further 1/8 of a circle to the transverse position. This is called as external rotation. The shoulders will be in the AP position. The anterior shoulder is under the symphysis pubis and delivers first. Remember that anterior shoulder delivers first, and the posterior shoulder delivers subsequently after the first one. Although this process may occur without assistance. Traction is often exerted by gently pulling the fetal head in a downward direction along the axis of the pelvis to help release the anterior shoulder from beneath the symphysis pubis. Normally, the rest of the fetal body is delivered easily, with the posterior shoulder guided over the perineum by gentle upward traction in the opposite direction, so delivering the baby on the maternal abdomen. Okay, to summarize the mechanism of labor: E. Engagement, D. Descent, F. Flexion, I. Internal rotation, E. Extension, R. Restitution, E for external rotation. Then comes D for delivery of shoulders and rest of the body.